We live in a state with a tremendous growing population, and we have probably for a decade or more realized that we have a tremendous need for better access for behavioral health services.
That's why in 2019, House Bill 1593 was signed into law to build a new behavioral health teaching facility at UW Medical Center Northwest.
So we're extremely excited. We're extremely proud to be partnering with the state on this incredibly important initiative. And we're very thankful for the state for their willingness to help us and support the building of this new building.
Northwest Adult Psych, this is Kai.
The team at UW Medicine and UW hit the ground running.
We've completed a pre-design phase. We're now in a project definition phase.
The vision is for a 7-story state-of-the-art building. Currently, there are only 27 beds on the Northwest campus. This new building will increase that to 100 beds, serving geriatric, voluntary, and adult psychiatric patients, and civil commitment patients.
It will greatly expand UW Medicine's capacity to serve patients who need inpatient psychiatric care, but it'll actually become a regional resource.
It'll also be unique in how care is provided.
There will also be 50 medical, what we call acute care beds. And the reason we're building those beds is because many patients that have a psychiatric illness will also have a medical diagnosis that will need to be treated.
So patients can get their care in one safe environment.
We have thought that through the process of treating really psychiatric care from all different aspects of the patient's needs.
It's also preparing for the future.
It's called a teaching facility because the other problem we have in this state, we have a tremendous need for more workforce in behavioral health.
UW Medicine has the largest training program for psychiatry residents in the country. Not only will this expand that program, it'll also train other healthcare workers.
We will train nurses and nurse practitioners, we will train clinical social workers, we will train physical and occupational therapists, and we will train peer specialists who can work alongside other healthcare professionals to really provide great care for people who are living with behavioral health problems.
Good steady gait.
While there's more work to be done, patients are slated to move in by 2023.
I think the entire team really embraced the mission of this building, the need for this type of care, and are very excited to be a part of it.
And it's more important than ever to have a resource like this.
COVID's been such a tremendous stressor, but it's created a whole new group of people who've had really difficult experiences, who have really been traumatized by this. And I think we were going to just see a tremendous increase in the need. So I think that timing is actually perfect. So it couldn't come on fast enough from my perspective.